if you see this on the website, on the career website, please apply. There's nothing that beats having one patient at a time. Open your mouth and network. Hello everyone, my name is Faber. Welcome back to my channel. I have an exciting video for you guys today. This is a video that I've been wanting to film for some time. It's honestly a video that I would have liked to have watched or seen while I was a new grad or even in my last year of nursing school. This video is going to be for people that are looking to leave the bedside or honestly avoid it totally. In this video, I'm going to be talking about 15 low-stress nursing jobs that you can get that can provide you a better work-life balance and lower stress in general. I will mention if you can get these jobs as a new grad and what kind of experience you would need to get some of these jobs. So if that's something you're interested in, please keep on watching. Don't forget to like and subscribe if you found this video helpful, and comment down below what job you didn't know about that you learned about from this video. The first job I have for you guys is pre-op / PACU. I put them together. This is a job that can provide a lot of flexibility for people and still provide you with skills. People usually call PACU the place where ICU nurses go to retire because honestly, it's a nice little gig. But the PACU can be hard to get into if you don't have ED or ICU experience. This is very dependent on hospitals. Pre-op, honestly, I think of pre-op as like a combination of like ED and floor nursing. Because with pre-op, you're putting IVs in and you're doing like a shortened version of an admission. So remember, patient comes for surgery, you take off their clothes, give them hospital gowns, you put an IV, you review consent, you ask them about their medications. If this is sounding really familiar to people that work on the floor, that's because that's the basic admission we do for most nurses. And the IV part of it is something that if you're very skilled with IVs or you've worked in the ED, pre-op is the really perfect gig for you. So pre-op and PACU, and I put this on this list because you can get a flexibility of schedules with these jobs depending on what hospital you are. Pre-op and PACU can offer 8-hour shifts, 10 hours, 12 hours. The second low-stress nursing job I have for you guys is aesthetic nursing. This is something that I don't know too much about, but can be very low stress. Honestly, with aesthetic nursing, you're not even working in the hospital. You're working at a spa or a doctor's office, a dermatology office. This is the kind of job that you would need connection to get, or just applying. Because I don't know of anybody that got their aesthetic nursing job very easily. So if you're interested in this, I would highly suggest perhaps getting like some type of bedside experience or ICU experience first, just so you can have those skills, because I don't think aesthetic nursing is something that's going to give you traditional nursing skills if that's something that you would later want to use down the line. The third low stress nursing job I have for you guys is to become a nurse educator. If you know anything about nurse educators, we're very short on nurse educators. I feel like we're going to be short on nurse educators for a long time. If you're someone that has passion for teaching people and you're very confident in your nursing skills, I highly suggest looking into it. You can teach clinicals, you can teach online classes, you can teach physical classes, you can work for a hospital and be the nurse educator for a certain unit or the whole hospital. Please, and if you live in North Carolina, you can get your master's in nursing education, and that's something that qualifies for you to get your loans paid for. Don't quote me on that, but that's something that if you live in North Carolina and you're interested in that, please look into that. You can get your master's in nursing education if you're really interested in that. We need nursing educators out here. The fourth job I will be talking about is dialysis. Dialysis nursing is something that is not quite talked about, but I feel like people that like it enjoy it. It's like a sweet gig, because remember, you only have maybe 1 or 2 patients at a time. You can work in hospitals, you can work in outpatient dialysis clinics. There's always going to be a need for dialysis nurses with the rate of diabetes and kidney issues. Dialysis nursing is something that I would highly suggest if you're someone that works on the floor right now. And I would want to say they take new grads, but if you're someone that wants to go that route, I would say even get like 6 months or a year of nursing on the floor before you do that, just so if you don't like it, you can pivot into something else without worrying about not having certain skills. This is going to be a big one. The fifth job I have for you guys is procedural nursing. This is an umbrella which comprises of operating room, interventional radiology, cath lab, EP lab, endoscopy or GI lab. I personally work full-time in the OR, and it's one of the best jobs I've had. If you're someone that likes having one patient at a time, likes being a part of surgery or procedures, I highly suggest procedural nursing. With OR, it can be hard to get, but most hospitals have like new to the OR kind of programs where if you have nursing experience or you're a new grad, they will train you to become an OR nurse. I know places like IR and Cath Lab, they highly want people that have ER, significant ER experience, ICU experience, or if you're someone that works on like a cardiac floor, if you have like cardiac step down kind of experience, just someone that's used to the kind of medications or types of patients. If you're someone that like maybe on your floor you pull sheet, those are the kind of people that will want working in IR. But I highly suggest looking into it because there's nothing that beats having one patient at a time, and there's a lot of skills to learn. And if you're someone that maybe gets an OR job, probably easier for you to transition into IR, cath lab, endoscopy, and stuff like that if that's something you would want to try down the line. Sixth job I have for you guys is discharge unit, and this is a job I've had. It's not common, not every hospital does this, but if you see this on the website, on the career website, please apply. You don't need a lot of experience. They really don't need nurses to do it, really. I feel like they just have nurses there just so they can have like a licensed professional, really. Because I did this job while I was back in Charlotte and I worked for a big hospital. Basically, all this is patients that are waiting on their rise. They already discharged. So it's called a discharge unit, but you're really not doing any discharge paperwork. You just have patients that are occupying a bed that somebody else could be using, and maybe they have to wait 4 or 5 hours for their ride. We just have like, it's like a lounge that we bring the patients down to. At that hospital, the lounge is really close to like the entrance or exit of the hospital. So when their ride was here, we just wheeled them out. Technically, if they need like educational reinforcement, you would do that. But all of the paperwork, IV, everything's taken out. You're just literally babysitting them while the ride comes. That's really what it is. But on the other end, some hospitals have what they call like an admission discharge nurse. So you would actually be working in the hospital, but all you do is usually it's during day shift. So you're the nurse that, if regular nurse that has like 5-6 patients has like 2 admissions, you would be the person to do all the discharge paperwork and then take them out. And if there's an admission, you do all the admission paperwork. That way it relieves the nurse of having to worry about all that, because if you know anything about day shift, admission and discharges can make or break your day. So that's something that if you're someone that lives near a hospital that offers that, because not a lot of hospitals offer it, and I feel like every hospital that's giving their nurses 5-6 patients needs to offer that, especially on day shift. The 7th job I have for you guys is a wound care nurse. This is something that, honestly, if you're someone that likes wounds, likes ostomies, I respect you a lot, because that couldn't be me. And you know what? I feel like that's why there's such a demand for them, really, because it takes a lot for you to see the kinds of wounds we see every single day, dress it up, and just keep going. But if you're someone that doesn't care for that, or you're someone that works on like a geriatric floor, you've worked in nursing homes, you've seen the worst of wounds, honestly, sign yourself up. Because really, the hours are good. You're not doing patient care. You literally, most of the time when they come to the floor, they just come, they go to their patient room, they change the wound bag, they change the ostomy, they provide education to the patients, they put their note in, and they're out. I believe all you need to do to become a wound care nurse, there's like a certification, education thing you would have to pay for. You can have your bachelor's, you don't have to have your master's. Just go through the certification and just be passionate about it, really. I feel like anybody that would even think about applying should be given a job. The 8th job I have for you guys is case management. This is something that has potential to be high stress, but I put it on this list because there's also potential for you to work hybrid or work from home. Case managers usually coordinate patient care, the resources, so all the discharges. This has potential to be high stress if you work in a hospital that doesn't have a lot of resources, or you live in an area that doesn't have a lot of resources, and you end up getting repeat admits of patients that basically become residents of the hospital. It can fall on case management's head a lot of the time. Look into case management. The hours are good. You have that potential to work hybrid or work from home. And honestly, if you work for a decent hospital in a decent area, it can be very low stress. Job number 9 is informatics nursing. If you're someone that is interested in the IT part of nursing, so basically think charting and all of the computer part of nursing, but you still like the aspect of being part of the nursing process, but in the IT way, I highly suggest informatics nursing. Like like aesthetic nursing, you have to network. I rarely ever see like a job posting for informatics nurse. This is something that is usually going to be internal hires or somebody that knows somebody that knows somebody. So if this is something that you have significant interest in, start by calling your informatics department in your hospital and see if you can shadow somebody or just start talking to people. I would highly suggest, and this is something to take away from this video, before you try to go apply for any job or take any job, try to see if you can shadow or talk to somebody that actively works there. I know people that have come to work in the OR and they quit a couple months after. And they're like, this is the worst shit ever. And then there's me that's like, this is the best job I've had in a while. It might not be for you. I highly suggest doing your research and seeing about shadowing if you can shadow. Job number 10 is employee health / public health nurse. So these people focus on community health, education, and outreach. You can work as like employee health for just about any company. Think about it. Every single like in-person company has an employee health department, and there's usually an employee health nurse. Especially hospitals. Think about when you're onboarding into a hospital, you go talk to an employee health nurse that looks over your vaccinations and stuff like that. Or if you're someone that wants to work for the county health department as a public health nurse. Again, this is people that like education, like outreach, like focusing on community health. This is something that I would highly recommend. You might need at least like some type of nursing experience before doing this. Not sure if you can get it as a new grad, but look into it. Job number 11 is infusion nursing. These are people that are good at IVs. If you're not good at IVs, stay away from this job. People that are usually taken for these jobs will be people that work in the ER, or if you're just IV team, that sort of thing. If you're good at IVs, please look into infusion nursing. You can work with a hospital or you can work with like a hydration center. I know most probably in the hospital you'll be working for like a cancer center, giving like IV hydration or chemotherapy drugs. So again, this can be somebody that maybe has worked on an oncology floor for a year and is good at put in IVs and people that usually have really bad vasculature. Go apply for infusion nursing. It can be a really good gig. Number 12 is a virtual / helpline telehealth nurse. This is something that's getting more popular, especially with like bigger hospitals trying to incorporate virtual nurses. They already have this in ICUs where they call it the EICU, but now they're bringing it to the floor where they have like a camera and somebody watching. So you can have the nurse on the computer verify medications with you. You don't have to get another nurse. It can be good, but I know there's some like pushback with that, because really why can you have nurses on the ground, right? Telehealth nurses are people that are going to provide care for people over the phone. This kind of job requires someone with a lot of experience. I don't believe they take people with like less than like 3 to 5 years of experience. Because remember, you're working over the phone. Your assessment skills has to be top notch. You have to know what you're talking about. You have to actually be a resource. You can't just be someone that's figuring it out. You have to actually know what you're doing. Job number 13, we're almost 30, and number 13 is research nursing. This is something also that's going to be more popular in bigger hospitals. Think about teaching hospitals that usually do a lot of research. And this is something that, again, that might require a little bit of networking. I can't recall really seeing a lot of job postings for research nurse. Aside from hospitals, though, if you work in like areas that have a lot of like biomedical companies or research companies, that's something to also do. Because remember, all of these pharmaceutical medications have to be researched before they come to us, and they usually need nurses to like watch the patients while they take either the medications or the placebos. So you'll be assisting with like clinical trials and stuff like that, and I highly suggest that you open your mouth and network. So if there's a surgeon or a doctor that comes to the floor and you know that there's someone that does a lot of research, clinical trials, talk to them. You never know what they're working on or what kind of help they might need. It might not be something that they'll hire you on as full-time immediately, but just get your foot in the door, basically. Jobs like that, it's all about getting your foot in the door. Job number 14 is IV team. God bless IV team people, and this is a job that I wish I could get somehow, but I know I'm not qualified for it. But one day I'm going to find out how to get qualified for it, because it's really nice. You really come with the ultrasound when we've all tried on the floor to get an IV in this patient. If an IV team nurse cannot get an IV in a patient, they're probably going to be getting a central line. Someone that has ICU experience, ER experience, or you're just someone that's good at IVs. You're the IV person, because every unit or floor has that one person that if there's a hard IV, they're gonna get it. So if you're that person, look into getting IV team nurse job. The last low stress nursing job I have for you guys is school nursing / private pediatric duty nursing. So if you're someone that has any type of peds experience, peds ER, peds med-surg, peds ICU, or you just like working with kids, I highly suggest working as a school nurse. You have regular hours, you have the weekends off, you have summers off. You work in schools providing care to students, and there's minimal emergencies happening. I mean, kids have codes and that kind of stuff. That's the type of thing you like take care of, which could get stressful, but really most pediatric nursing staff that I heard or talked to all like it. I know it has a bad rep to pay low, but if you're someone that's interested in it, try going the agency route to get that school nursing job. That way you can get paid a lot more instead of settling for what the school system wants to pay. And if you're someone that maybe you've done that for a minute, get a PRN job as a private pediatric duty nursing. Just remember, there's a lot of sick kids that maybe have to live with like trachs, pegs, and may require like 24/7 care. That's something you could do. And remember, you would only have that one kid to take care of. So all you're doing is really giving them their feedings, giving them their medications. And if you get lucky and build a relationship with some of these families, you could get lucky and basically get to work with a family one-on-one, and they could pay you out of pocket and pay you a lot of money. Think about it, there's some families that will pay any amount for people to watch their kids, especially a licensed professional that knows what they're doing. The end of this video has come. I've rambled on and on and on, but I hope you guys have learned something from this video. Don't forget to like, comment, and subscribe. I really enjoyed making this video, and I hope you guys watch out for the next video because I have more of this coming. Thank you.